Most of us are taught to believe something from a very young age. If a doctor recommends an operation, you simply say yes. You assume it is the only choice, the best choice, and the safest choice. The medical team is ready, the hospital room is booked, and all you have to do is sign the paperwork. I used to look at things the exact same way. But after spending over 20 years in the operating room as a chest and heart surgeon, my perspective changed. I started paying closer attention to the numbers. I started tracking what happened after the operations, not just whether the patient survived the day, but how they actually lived in the weeks and months that followed. I began to see a troubling pattern. Many older adults would go in for what was called a routine procedure, but they came out completely changed. They weren't better. They were just different. I watched a grandfather walk into the hospital complaining of back pain, only to leave in a wheelchair, unable to walk at all. I saw a vibrant grandmother survive a major heart operation, but lose nearly a year of her life to painful complications that no one had truly warned her family about. Here is the truth that rarely gets discussed in a busy doctor's office. The older your body gets, the harder it has to fight just to survive the stress of an operation. Often, the biggest threat to an older patient isn't the disease itself. It is the trauma of the surgery. My name is Dr. David Mitchell. I am a surgeon with over 2 decades of experience, and today, I want to share some honest, vital information with you. We are going to discuss 5 specific surgeries that carry massive hidden risks for older adults. Before we look at the specific surgeries, let's look at why this happens. Think about 2 cars. One is brand new, straight from the dealership. The other is a classic car that is driven hundreds of thousands of miles. If you put both of those cars through a brutal high-stress endurance test, would you expect the exact same result? Of course not. The older car might look beautiful on the outside, and it might run perfectly well on a quiet neighborhood street, but its parts have experienced decades of wear and tear. For a long time, modern medicine treated an 80-year-old body the exact same way it treated a 40-year-old body. Doctors used the same surgical methods, expected the same recovery times, and used the same medications. Thankfully, that way of thinking is finally changing, but it is not changing fast enough. Let's look at what actually happens inside an older body when a surgeon puts you to sleep under general anesthesia. The heart. Your heart has to work twice as hard to pump blood while dealing with the stress of the operation. The lungs. It takes much longer for older lungs to clear out the heavy anesthetic gases. The kidneys. Your kidneys slow down, making it much harder for your body to process and clear out powerful surgical drugs. The brain. This is the one that catches most families completely off guard. When an older patient goes under deep anesthesia, the brain can become severely disoriented. This isn't just a few hours of grogginess. It can cause confusion, memory issues, and personality changes that last for weeks, months, or even permanently. Doctors call this post-operative cognitive dysfunction. It happens far more often than the medical community likes to admit. Now, please hear me clearly on this. Age alone is never a reason to avoid a necessary surgery. I have operated on 85-year-olds whose bodies were so strong they recovered faster than people half their age. Age is just a number on a piece of paper. But frailty is something entirely different. Frailty is a real medical condition. It means a person's physical reserves have dropped to a critical level. Their body simply doesn't have the extra energy or strength to bounce back from a major physical trauma. Statistically, about 15% of people over the age of 65 show clear signs of frailty. But once we look at people over the age of 80, that number jumps to nearly half. So when we talk about major surgery for an older loved one, the real question is rarely, can they survive the hours on the operating table? The real question must always be, can they survive the grueling months of recovery? Those are two completely different things. And understanding that difference is what this video is all about. The first surgery we need to look at is major open heart surgery, specifically what doctors call a bypass operation, or CABG. This is one of the most common major operations performed on older adults today. The basic concept makes perfect sense. Your heart arteries are blocked, so the surgeon takes a healthy blood vessel from another part of your body and uses it to reroute the blood flow around the blockage. For a relatively strong, active patient, it can work wonderfully. But let's look at what the glossy hospital brochures don't always explain. To perform traditional open heart surgery, the surgeon must completely stop your heart from beating. To keep you alive, the medical team hooks your body up to a heart-lung bypass machine. This machine takes over the work of pumping your blood and providing oxygen while the surgeon works on your heart. For a 55-year-old who is otherwise healthy, the body can usually tolerate this machine. But for an 80-year-old who is already dealing with mild kidney issues, early memory loss, or diabetes, that bypass machine acts as a massive shock to every single organ in the body all at once. Medical studies show that for frail elderly patients, open heart surgery carries a 20% to 30% risk of devastating complications. We are talking about severe strokes, sudden kidney failure requiring dialysis, long-term mental confusion, and inability to breathe without a ventilator machine. Furthermore, data shows that up to 10% of high-risk elderly patients do not survive the first month following this aggressive procedure. Thankfully, modern medicine has advanced. Today, we often have a much gentler option known as TAVR, transcatheter aortic valve replacement, or other minimally invasive catheter-based procedures. Instead of cutting open the chest and stopping the heart, doctors can use a tiny, flexible tube inserted through a small, freckle-sized nick in the leg to repair or open up the heart vessels. It doesn't require a heart-lung machine, and it is far kinder to an older body. If a doctor tells you or a loved one that open heart surgery is needed, you do not have to blindly accept it. You should look that doctor in the eye and calmly ask, am I a candidate for a less invasive, catheter-based approach? That single question can completely rewrite the outcome of a life. The second area of concern is major aggressive back surgery. Let's be completely honest. Back pain in your 70s and 80s is incredibly common. Almost everyone dealing with spinal wear and tear experiences it at some point. Because it hurts so badly, people become desperate for relief. Increasingly, they are offered major surgeries like spinal fusions, where heavy metal rods, screws, and brackets are permanently bolted into the spine. I want to be completely unambiguous here. Some spinal surgeries are absolutely mandatory. If a senior has a piece of bone actively crushing their spinal cord, causing them to lose control of their bladder, or causing their legs to suddenly go paralyzed, they need emergency surgery immediately. There is no debate. But what about elective spinal fusion? This is surgery done purely to try and fix chronic, dull, aching back pain in an older adult. When we look at the data, the reality is deeply concerning. A massive study published in the respected medical journal Spine found that for patients over the age of 75, complex spinal fusion surgeries had a complication rate of over 40%. And these were not minor complications. They included dangerous blood clots, deep surgical infections, failure of the metal hardware itself, a condition called adjacent segment disease. Adjacent segment disease happens because the human spine was built to bend. When a surgeon bolts several vertebrae together, that section becomes stiff as a rock. Because that section can no longer move, the joints directly above and below it have to take 100% of the physical stress. As a result, those nearby joints quickly break down, causing entirely new, often worse back pain. What breaks my heart as a medical professional is that multiple studies show that for a vast majority of seniors with degenerative back issues, aggressive surgery provides no better long-term pain relief than a dedicated program of specialized physical therapy and targeted, precise pain injections. The surgery carries dozens of massive risks, yet the actual long-term pain relief is often exactly the same as non-surgical treatment. A brilliant spine surgeon I used to work with once shared a piece of wisdom that I will never forget. He said, "David, sometimes the most successful operation a surgeon can perform is the one they choose not to do." The third type of surgery we must address is major cancer removal operations. This is by far the heaviest topic to discuss. When a human being hears the word cancer, a powerful natural instinct takes over. The immediate reaction is to say, "Get it out of me, cut it out, do whatever it takes to remove it." I understand that emotional response completely. If it were me or my family, I would feel the exact same way initially. But 2 decades in medicine teaches you that treating cancer is not just about hunting down and removing the tumor. The true goal of medicine is to give a human being more good, high-quality years of life. Sometimes, undergoing a massive, brutal surgery does the exact opposite for an older, frail patient. Let's take a realistic look at a procedure called the Whipple procedure, which is used to treat pancreatic cancer. It is one of the most complicated and physically demanding operations in the entire world of medicine. The surgeon removes the head of the pancreas, a large portion of the small intestine, the gallbladder, and part of the bile duct. The operation easily takes anywhere from 6 to 8 hours to complete. In a young, vibrant, otherwise healthy patient, this surgery can be a literal lifesaver. But let's look at an 82-year-old who already has a weak heart or reduced kidney function. The surgeon might perform the operation flawlessly. The tumor might be 100% gone. The surgery, on paper, is called a success. But the patient's fragile body is so shattered by the 8 hours of trauma that they pass away in the intensive care unit a few weeks later from infections or organ failure. They did not pass away from the cancer. They passed away from the treatment. In medicine, this is sometimes referred to as a futile surgery. A major study by the American College of Surgeons discovered that nearly 1 in 5 elderly cancer patients who underwent major tumor removals suffered from something called failure to rescue. This means a standard complication occurred after the surgery, but the patient's body was simply too weak to fight back and recover. You must have an open, transparent conversation with the cancer specialist. Look at them and ask this specific question. If we decide not to do this surgery, what does careful monitoring, gentle radiation, or targeted therapy look like for someone of my age and current health status? Sometimes, choosing a gentler treatment plan allows an older adult to live out their remaining years in comfort, surrounded by family at home, rather than spending their final weeks plugged into machines in a cold hospital room. The fourth category involves elective joint replacements such as hip and knee surgeries. Let me state this clearly. Hip and knee replacements are some of the most successful, life-changing medical procedures ever invented. When performed on the right patient, a joint replacement completely restores freedom. It takes a person who can barely stand up from a chair and allows them to walk without pain, tend to their gardens, and play with their grandchildren. It is beautiful to see. But things become highly complex when we look at older adults who are already suffering from multiple serious, ongoing health conditions. The word elective means the surgery is not an emergency. You are not bleeding out. You have time to sit down, think, plan, and analyze if your body is truly ready. If an older adult has 3 or more major underlying conditions, such as severe heart disease, advanced diabetes, kidney disease, or extreme obesity, an elective joint replacement suddenly becomes a high-stakes gamble. The biggest hidden danger here is blood clots. During and after joint surgery, the risk of deep vein thrombosis, clots forming in the deep veins of the legs, is incredibly high. If one of those clots breaks loose, it can travel straight to the lungs, causing a pulmonary embolism, which can be instantly fatal. For seniors who already have poor blood circulation, this risk skyrockets. Additionally, because it takes an older patient much longer to get up and start walking after a joint replacement, they spend a lot of time lying completely flat in a hospital bed. This prolonged immobility opens the door for post-operative pneumonia in the lungs, dangerous hospital-acquired infections like MRSA, severe bed sores. I do not share this to terrify you or scare you away from getting a new hip or knee. I share this so you can focus on preparation. The question you need to ask your doctor isn't, should I get this joint replaced? The question must be, is my body in the absolute best possible condition to handle this right now? Taking 3 to 6 months before the surgery to safely lower blood pressure, stabilize blood sugar levels, improve nutrition, and strengthen muscles can cut complication rates in half. Many top-tier hospitals now require older patients to complete a formal prehabilitation or prehab program before scheduling surgery. This means getting into physical shape before the operation, and it is a wonderful approach that saves lives. Finally, we must talk about emergency abdominal surgery. This fifth surgery is very different from the others we have discussed. You do not get to sit at home and choose whether you want emergency surgery. It chooses you. We are talking about sudden, life-threatening crises, a hole in the bowel, a ruptured appendix, or severe internal bleeding in the stomach. These events do not give you time for a relaxed chat in a doctor's office. So why is it on this list? Because understanding the immense risks of emergency surgery before a crisis happens changes how you and your family make decisions in those terrifying midnight moments in the emergency room. Emergency abdominal surgery on patients over the age of 80 carries some of the highest mortality rates in modern medicine. In severe cases, the risk of passing away can be anywhere from 20% to 40%. This high percentage is not because the surgeons are unskilled. It is because an older body, facing a sudden, massive trauma, is forced to fight a war on too many fronts simultaneously. The liver, the lungs, the heart, and the kidneys all take a massive physical hit at the exact same moment. Furthermore, the intense immune system inflammation that a 30-year-old body can successfully control within a couple of days can spiral completely out of control in an older adult. This can lead to a dangerous condition called systemic inflammatory response syndrome, where organs begin to shut down one after another. So knowing this, what can you actually do to protect yourself? There are two concrete steps you should take. First, never ignore stomach symptoms. If you or an older loved one experiences ongoing abdominal pain, strange bloating, or sudden unusual changes in bowel habits, do not ignore it. Do not just wait for it to go away. Catching a bowel or gallbladder issue early means treating it safely with routine, planned care, entirely avoiding a midnight emergency room crisis. Second, have the hard conversation with your family right now. Do not wait until you are standing in a chaotic hospital hallway at 2 a.m. Sit down with your spouse, your children, or your power of attorney while everyone is healthy and calm. Explicitly tell them what your wishes are. Explain what level of quality of life matters to you and what boundaries you want respected regarding life support machines. These conversations are not depressing or morbid. They are one of the most deeply loving, protective gifts you can ever give to the people who care about you. We have covered a lot of heavy information today, but remember, information without a clear plan of action just creates unnecessary anxiety, and that is the last thing I want for you. Before you or anyone you love ever agrees to a non-emergency surgical procedure, I want you to take out a piece of paper, write down these 4 simple questions, and take them to the doctor's office. What exactly will happen if we choose not to do this surgery right now? Listen closely to see if there is time to slow down, think, or try other options. Is there a less invasive, robotic, or catheter-based alternative available? Medicine is advancing daily. Always check if a gentler path exists. What does the recovery process realistically look like for someone with my specific health profile? Do not accept a generic answer about the average patient. Demand an answer tailored to your heart, your kidneys, and your daily life. What is your personal complication rate for this exact surgery in patients over the age of 75? An honest, skilled, and highly confident surgeon will respect this question and give you clear, transparent numbers. As we come to the end of our time together, I want to leave you with something genuinely hopeful. This discussion is not about living in fear. It is about empowering you with choices. And today, your medical options are more powerful than they have ever been in human history. Minimally invasive tools, advanced camera-guided surgeries, and robotic assistance allow modern surgeons to perform miracles through tiny fraction-of-an-inch incisions. This drastically cuts down on pain, bleeding, and recovery times for older adults. Furthermore, never underestimate the sheer power of optimized medical management. The right combination of modern medications, specialized physical therapy, dietary changes, and targeted non-surgical treatments can successfully manage conditions that used to require a surgeon's knife. The human body possesses a beautiful, instinctual desire to heal itself. Sometimes, our primary job as doctors is simply to step out of the way, Put down the scalpel and give the body the gentle support it needs to recover on its own terms. Always remember this one vital truth. A doctor's recommendation for surgery is not a final legal verdict. It is simply the opening line of a conversation. You are not a helpless observer in your medical journey. You are the executive decision maker. You have every right to ask the hardest questions, to demand alternative options, and to take all the time you need to think. The surgeon may hold the scalpel, but you hold the choice. Thank you so much for spending this time with me today. If this calm, honest look at medical health helped you or a loved one think more clearly about an upcoming decision, please hit the subscribe button, give this video a like, and share it with someone you care about. A single share could protect a life today. Please remember that everything I have shared in this video is for general educational purposes based on published clinical research. Every single human body is entirely unique. Before you make any final choices regarding medical treatments or surgeries, please sit down and have a full, unhurried, and deeply honest conversation with your personal healthcare team. Take great care of yourselves, stay informed, and always remember to advocate fiercely for your own health. I will see you in the next video.